In this video, we're going to talk about what it takes to make a successful dental school application and how by breaking it down into 4 distinct phases, you can maximize your chance of success. This is a conversation I have with one of my lead tutors, Daniela, who's asking me questions about my experience for how I got into dental school. So hope you enjoy it, hope you find it useful. And at the end, I'm going to show you some resources that are going to help you with your application and how to make sure you get into your first choice dental school. The first thing being CV building. So that's everything from work experience, so work experience being shadowing, your volunteering, your paid work, extracurriculars, further reading, all the stuff that shows that you want to be a doctor or a dentist. Now, for dentistry, those don't change that much from medicine. So a lot of the time, the advice that you get for med school applications, you can just simply change the word dentistry or GP practice to dental practice. And a lot of the time, the terms are interchangeable. So again, just really good shadowing experience in a dental practice or in a dental hospital, shadowing maybe an oral surgeon or somebody who is in the field and you're seeing what it's like being a fly on the wall and experiencing that. Volunteering, again, doesn't have to be dental. It's just volunteering is showing that you're a caring person, and essentially that's all you need so from a dental point of view, you need to show that you're able to care for other people and that you have empathy. Volunteering is where you practice those skills. Paid work is all about responsibility. This is less so for the grads, probably more for the undergrads, where at a young age, you probably don't have much demonstration of something where somebody is relying on you to be there. And if you're not there, they will suffer because of that. That's exactly what it's like to be a dentist. You know, people are in horrible pain with their teeth sometimes. And if you don't go to work and deal with those dental emergencies, you might leave them in the lurch for a day, for however long you're away for, until they might just wait until you come back to work. That's how sometimes people trust their dentist and how close that relationship is, that they're not willing to see somebody else. So the responsibility, and then just the interest. So that could be further reading, attending talks, summer schools, any sort of stuff like that. So that's probably phase 1, the CV building stuff. Shall I go on?
Yeah, please tell us.
So then the second phase is all about exams. So exams have to be on point. And by that, I mean, not just the ucat, and for dentistry, it is exclusively the ucat. You also have to make sure that all of your academics are on point. So whether that's a degree, and you really would ideally be aiming for a first, just to stand, again, each little bit where we can stand out, it's all about those marginal gains. So a first, but a 2-1 minimum really for requirement is 2-1. School exams, of course, we just want those kind of A-star AA or probably even higher. It'll probably continue to go higher, but good A-levels basically, or whatever the eligibility criteria is. But really what I'm talking about here is the ucat, because that is one of, I always think, simultaneously the most overestimated but undervalued. Have I said that right? I think I want to say it the other way around. Underestimated but overvalued. So basically, people think that it's all about the ucat, which is a mistake, but also people don't give the ucat the due attention that it needs to prepare to get a really good score. So we need to be making sure we're doing everything, and it is a learned procedure. I think people think, I'm just not good at it, I'll never get good at it. But again, on our program, we see every year, we see people who've come to us who've got a 2,300, and then they've gone through the program, they have done our teaching, and they've taken themselves from that to a really high score, hitting 3,000 plus. So doing what you can to prepare well for that is really important. And I talk about the 3-step process for that over here. After you've kind of prepared for the exam, then you've got phase 3, which is what I call crunch time. And that is basically when everything is hitting the fan. It's like all of it comes together, and you are sitting the exams that you've prepared for, sitting the ucat that you've prepared for if you're talking about dentistry or medicine. Then there's writing your personal statement, because the personal statement is very much, you can't do it too late because you don't want to have it rushed, but equally you can't do it too early. It's a bit like catching a flight, you want to get it just right. So you want enough time so that you've accumulated all the experience and you can talk about it in your personal statement, but again, early enough so that you can give it fair attention and time to get it right, because a lot of the time is going to be showing it to other people and waiting for them to give you feedback. So the personal statement, med school, dental school, grad med school choices are so important. I mean, on our program, what do? Like, we sit down with people for ages to discuss their 4 choices, which ones are the best, not for a general person in this category, but for that person with their individual strengths.
Yeah, definitely. Even like taking into consideration like personal circumstances and preferences, like taking everything into account is so important because it's such an individual choice, and what works for someone else might not work for you. So it's really something to think about. Yeah,
definitely. And all the time I'm getting comments from students going on YouTube videos being like, here are my grades, and here's my star sign, where should I apply to? And I'm like, well, it's so nuanced and it's so individual. Again, these are things that you can't just take here are these set of variables and here's what you should do. It's so individualized. So it's really important. But I argue that when I said sometimes the ucat is the most overvalued, I would say this is the most undervalued. People really don't quite understand how important those 4 medical, dental, grad, whatever they are, those 4 choices that you only get those. And unless you're applying to some of the private schools, but for dentistry, you don't really have many options for that. That is going to have a massive influence over how likely you are to succeed. And the final phase is all about interviews. And people think that it's just about kind of waltzing in with a couple of weeks of reading some questions and a little bit of kind of cursory practice to get where you want to be. But it's not at all. That is where a lot of people fall down. And again, I say every year we get people who have not got in, come to us for help, and they'll get 4 interviews and not a single offer because they've fallen into this trap, which is thinking that you can just blag your way through it. This is where the interview is the culmination of all the things that you've done prior to help you be ready for that point. And it's like the difference between people that I have experience of helping and the people who are not getting in is that they transform into the kind of person that would just is great. They're not trying to blag anything. They're not trying to pull the wool over interviewers' eyes. They have just become, or they are really the real deal at that stage. And I've interviewed people. I know what it's like when someone walks in the room, and you can just tell they are the real deal. And it's very difficult to not offer that person a place. So like I say, it's the kind of shifting the mindset from, can I tick these boxes? Can I get them to just like say yes, versus I am so bloody good and I can show them that I'll be a great doctor or a great dentist. And it's, like I say, very difficult for them to say no.
Yeah, for sure. The interview is arguably one of the most important points because you can have worked so hard on the entire application, but if you don't do well on the interview, you're not going to get that offer. So taking the time to really prepare for that is so key.
So I hope you find that useful. If you want to find out how you can make the most out of your dental school application and maximize the 5 key areas by breaking it down into those 4 phases that we talked about, check out this video here where I show you exactly how you can get help and how you can maximize your chance of success with your dental school application. Thank you for watching. I hope you found that useful, and I'll see you over in that video.